Good evening, everyone. And on behalf of the Science Awareness Committee of the Indian Women Scientists Association, WASHI, I, Sonam Ambe, warmly welcome you to the 60th talk under the Science and Our Life series of webinars. This is a special occasion for all of us at IWSA as we mark the 60th version of our enriching series. It began in 2020 as an initiative to bring science closer to people during the COVID pandemic, but has now grown into a very trusted platform for learning and engagement. And we take immense pride in having hosted 60 thought-provoking sessions in the last 5 years, each contributing to a deeper understanding of science in our daily lives. This milestone is a testament to the dedication of, not just the organization, but our speakers and the enthusiasm of our audience as well, and the unwavering support of the Board of Research in Nuclear Sciences, BRNS, which is under the Department of Atomic Energy, who have been our partners on this journey since September 2021. For those who are new in our audience, kindly allow me to briefly introduce our organization. The Indian Women Scientists Association, IWSA, is a non-profit, charitable and voluntary organization. It was established by 12 visionary women with two key objectives: taking science to the masses and women empowerment. And what day better than today, which is the Women's Day, to actually celebrate all our achievements together and also to have such an established speaker with us. Through 5 decades of dedicated efforts, IWSA has grown to include 11 branches and over 2,000 members, continuing to make a significant impact. Now, for more details about our initiatives, do visit our website at IWSA.net. Coming to the Science and Our Life lecture series, it is one of IWSA's flagship monthly activities. And through this series, eminent personalities from various fields shed light on the evolution and application of different sciences, helping the public understand their the relevance of science in everyday life. Now, the topics we've covered kind of range from architectural acoustic, e-waste management, astronomy and star photography in the recent past, and so many more that many of us kind of glimpsed through and ran through in the last few slides that Suparna was playing. If you've missed any of these fascinating talks, you can always find the recordings on IWSA's YouTube channel. So don't forget to like and subscribe. Coming to the meat of the matter, today's session promises to be just as insightful. Our topic is environmental influences on the clinical manifestation and management of type 2 diabetes mellitus, a subject of profound importance given the rising global burden of this condition. Our distinguished speaker will delve into the complex interplay of genetic and environmental factors contributing to the type 2 diabetes. Particularly in the rapidly westernizing direction that our country is going in. This discussion will encompass various environmental triggers that precipitate clinical diabetes in younger populations, and the significance of understanding and modifying these factors to prevent, delay, and the best thing to even reverse the disorder. And so that's, and also a small overview on how environmental influences affect type 1 as well. It is now my pleasure to introduce our speaker for today's talk, Dr. Sudha Tinaikar. Dr. Tinaikar is a seasoned medical professional with an impressive array of qualifications, an MBBS and MD in internal medicine, and MBA in hospital administration, and a postgraduate diploma in medical law and ethics. Since 1984, she has served in various hospitals across Bangalore and currently practices full-time as a consultant physician and diabetologist. We are honored to have you here with us, Dr. Tinaikar, and to share your expertise with everyone. Please join me in welcoming Dr. Sudha to the screen.
So can I start?
Yes.
Yeah. So good evening, everybody, all the listeners. This is a very important current topic right now, especially when it comes to diabetes, because a lot of talk is going on about reversal of diabetes. Of course, we're not dealing much with that today, But then earlier it was, I'll just give a brief introduction, then I'll start sharing my slides. So, we did not know it, though it's a complex kind of a disorder which has an interplay of genetic as well as environmental factors. How much each factor really plays a role, we even till today, we are not very sure of it. But what has happened is, since the last few decades, we are finding that the numbers of diabetic patients and pre-diabetics, those who are likely to go on to diabetes, is becoming so high and it's exponentially rising. Pardon? Anything?
Apologies, you can go ahead. I'll just mute all participants.
Yeah. So what has happened is that the numbers of diagnosed diabetics, pre-diabetics, it has gone up so much exponentially. So which has got a lot of bearing on the socio-economic status of the individual patients also. At the same time, on the health system of this entire country. And now a lot of importance is given to the environment. Genetic, we cannot do anything about it, but is it possible for us to do something about the environment so that we can either postpone or to some extent even prevent the appearance of diabetes in those who are prone to that? So that is going to be the topic of my talk today. And I think I'll start sharing my slides. Yeah, fine. So, one minute. Yeah, fine. Okay. Can the slides be seen?
Yes, sir.
Yeah. So I just want to, bring you to the number game. It's of course my slides may look a little crowded to you because a lot of information is there, and I've tried to minimize the number of slides. These are the numbers which are quite horrifying, actually, and it's almost 11% of the population in India. I'm talking about the Indian numbers, okay? It's maybe slightly less in the Western world. Even then, it is together, if we take the entire, world population, about 9 to 11%, and the highest number of diabetic patients, pre-diabetics, are in India. It's 11% of Indian population. Out of them, 15.3% are pre-diabetics. This is according to our own ICMR study and some other World Diabetes Organizations. And if you take it in real numbers, it's almost 25 million people who are in what is called as the impaired glucose tolerance or pre-diabetes range, which is likely to go up to almost 35 million by 2045. Right now, how many diabetics are there who are recognized, diagnosed, and treated? 77 million in India, likely to go up to 134 million by 2045. And mind you, these are the diagnosed numbers. And there are people who are undiagnosed. You just see that next, 57% of these are undiagnosed. Okay, many of them are yet to, if we really improve our screening methods, we'll find probably the number goes still higher. And what is its impact now on that? What happens with this kind of an exponential rise in diabetes? What happens to the life expectancy? What happens to the quality of life? What happens to the diabetes related complications? What happens to the financial impact, not only of the patient, but also in the entire country? How much is our budget? Our country's budget towards health is minimal. We are still a country where there is a private funding. Each person funds, of course, insurance is there, there's no doubt about it, but it is a private funding. And you may be surprised to know that only 1 in 3 patients, this is the latest, on the World Diabetes Day recently, it was shown that there are only 1 in 3 diagnosed patients who are on treatment. Very, very dismal, very difficult. Just imagine that if all of them have to go on treatment. Let's see what are the causes that make these people drop out of treatment or don't allow or they don't want to go on treatment. Next one, we'll just go through this environmental factors. See, though we know that it's a multifactorial disease, diabetes is both it's a complex interplay, as our the person Ms. Ambe who introduced the topic. It's a complex interplay of genetic, it's like the genetic environment of every individual. It's a familial disorder. It's also a genetic disorder, but how much exactly the genetics contribute, what is the familial genetic, it's all, we can take it as one group. Then, of course, environment and lifestyle. And today we are more interested in preventing the trigger, because genetic, propensity towards diabetes is something which is like a loaded gun. We cannot do anything about it. If you are predisposed to diabetes, you can't do anything about it. You have got it in your genes. But is there some way in which you can prevent the triggering of this ultimately? That is what we have to really know now. Then now, what is happening? Therefore, there is more stress now on environmental modification for not only that prevention of pre-diabetics going on to diabetes, prevention of diabetes itself, right from a younger age, control, and the very, very questionable, new topic of reversal of diabetes. There's a lot of things going on now. You might have seen reversal, diabetes can be reversed. A lot of it, how much of it is real, how much of it is a hype, that we are not going to go into in this particular session. So what can we do to modify the environmental factors which are in our control, so that we can to some extent prevent the progress of diabetes? And here in India especially, we find that the rising diabetes population is linked to several environmental factors, many of them actually. There are so many factors, but it's nice to know that if we are exposed to one or more of them, can we as individuals take the responsibility of doing something about it, so that we can prevent the progression of diabetes if we are already diabetics, or prevention the progress from pre-diabetes to diabetes if we are pre-diabetics. And if I'm not yet a detected diabetic, but if I have a strong family history and a high genetic propensity to diabetes, is there some way I can modify my lifestyle so that I can prevent being a diabetic? Okay. So let's see what are the environmental factors that are likely, which have really contributed of late in the last few decades in India, especially. Lifestyle changes. So there is a dramatic change in the lifestyles. If we see our own parents, how they were and how we are today, the change in the lifestyle is something absolutely, it is something, which cannot be blamed. Now, the most important thing in lifestyle changes is a rapid urbanization, because most of the people are leaving the rural and the typical agricultural society now has become more of an industrialized society. So a rapid industrialization took place in the form of urbanization. So a lot of population has gone from the villages and rural areas where the physical activity was more. There was not much of a sedentary lifestyle. With rapid urbanization, what has happened? The way we eat, the way we live, what we consume, how everything has changed. Our entire lifestyle has changed. With that, as a consequence, our physical activity has come down. We have become more sedentary. We have more food options now. Whereas in a rural or an agricultural society, or even in our childhood, we didn't have so many food options. Now we have multiple food options, junk food, unhealthy eating outside in restaurants, don't know what we are eating. So there's a lot of change in our lifestyles. Most important is the dietary change. What was our diet earlier? That of whole grains and vegetables and more, foods with more fiber content. Now we have gone more towards refined carbs. We have become more westernized. They're very high in sugar. And most of our snacks, which we are snacking, especially the packeted snacks, they are full of unhealthy fats, trans fats. So this dietary habits have changed to a very large extent. And how they have changed, not, gradually, because the genes or the body, the genetic pool is not ready for such a rapid change. That is what is happening. It takes sometimes generations and generations for the genetic pool to change and adapt itself to the new ways of life. But what has happened here is our genetic pool remains the same, whereas our lifestyle has completely changed, and our diets have changed, our lifestyles, our activity level, everything has changed. And there was a small study done in our own country called as the Wealth Index and Diabetes. It was long ago. It was done long ago when we found that diabetes was increasing in Indian population, and they found that as the wealth index increases, especially those who have migrated from the rural to the urban populations, the incidence of diabetes went on increasing. And they took very simple things: those who have a vehicle to move around, and those who have certain electrical and electronic gadgets at home, where where the physical activity comes from, how the incidence of diabetes is going up. So it just shows that we have become more of couch potatoes, we have become more of sedentary, and food is available to us all the time. All the time, food is available to us whenever we want. There's no question of the body trying to go on its routine circadian rhythm of eating and resting and activity. No, the whole thing, our whole circadian rhythm has changed. So our food has become absolutely unhealthy. What about our physical activities? Manual activity has come on. I remember my own, parents and grandparents, the amount of physical activity they had to walk everywhere. There was no question of, getting a vehicle, if, unless, cars were very few at that time. We had to walk. Our parents had to walk everywhere. Even at home, all the work was done more manually. Now, what has happened with the increased use of technology, with remote control, with better transport systems? What has happened is domestic activity has come down. We are spending a lot of time, sitting at home doing nothing, sedentary lifestyle, because at the at the reach of a button, we have everything going on for us. So there's no need for much of an activity for us. So especially in females, especially those who are at home, even those who are working, we'll see that later. Even in people who are working, we find that the physical activity is absolutely gone down. Then we have very few green spaces and walking spaces. Now, if I have to walk somewhere, there were times when we could walk without, getting interrupted by anything. But today, a straight walk for 1 kilometer is not possible in the urban areas because of the traffic, because of the inadequate walking spaces, no green spaces, dust and all environmental pollutants, which are going to come later. So because of all these things, what has happened now is that there are inadequate places for exercise and walking also. Of course, now we are finding that in the urban areas, people are waking up to that, and we are having park spaces, and then we are having places where some exercise equipment is kept and all that. Yeah, but then we are finding that our activity level basically has come. Obesity pandemic is the next most important thing we have found in our own country. If we remember, even one generation earlier, those who were fat the number was very less. But nowadays you find that obesity is increasing. Actually, it's a pandemic. More so in the Western countries. I'm sure you all have seen how that probably 1 in 3 or 1 in 4 abroad you'll find they're obese. But here still, now I find in my own patients, I find that more than 50% of the diabetic patients are very, very obese. So what happens is here is high calorie foods, processed foods are available, fatty foods are available, food is available at any time. We're sitting long hours in our jobs. Those are working also, sitting for very long hours in front of the screens and not really moving much at all. Increase screen exposure. Even those who can move around, those who can, go for a walk, have exercise, no, they're more attracted towards the screen. With the TV and with the laptop and with the mobile, we are more, the screen time, the screen exposure has gone up like anything, which is making us more sedentary. Not only that, it is interfering with our circadian rhythm of sleep, our digestion, and so many things. Then, of course, limited physical activity, easy access to food. Then perimenopause, especially women around menopause at the time between 40 and 50. I find, because I'm dealing with a lot of diabetic patients, pre-diabetics, that is the time when women suddenly put on weight and they are, prone to diabetes. Many of them are detected to be diabetics at that particular, period of their time. And they're not maintaining their exercise schedule. They are not bothered about what they are eating. And suddenly find there's a lot of redistribution of weight and people are putting on a lot of weight in those 10 years. And this weight gain also is something which is not easily, manageable. That's what is happening. In the initial stages, when obesity is starting, we don't do anything. We wait literally till obesity starts telling us that, look, I'm fat now. We don't do anything about it. Initially, as I'm putting on weight, it is easier for me to lose weight. But once the weight gain is fixed, it becomes very difficult to lose weight. And of course, in today's world, laziness. We are all lazy, whether we like it or not. We are lazy because everything is available at, literally, a hand's distance and at a, distance of our mobile phones. So therefore, there's laziness has become like, if you want to get up, go and do something. No, we don't do that. And we lot of domestic help available, so many other things. We're not even doing what we are supposed to do. Laziness is. Now you may ask whether obesity is urban or rural. It's not that it is, only limited to urban areas. Even nowadays, even we are finding obesity even in rural areas also. Because unless it is absolutely a rural area which is not accessible to any of the other, things. But nowadays, I think to say anything is a rural area, it's very difficult. We don't find for miles together. For example, if I'm traveling from Bangalore to Mysore, earlier we would find a lot of villages on the way, but nowadays we don't find. The whole stretch is full of human habitation and modernization and also urbanization. So there is no question of urban or rural here. Now obesity is becoming more of a pandemic. It's equally affecting urban and rural, both areas, because this kind of a change in lifestyle has become something true for both urban and rural individuals. Then we have the social and economic factors, socio-economic factors. Now let's see Western world against India. Here we find that in the Western world, they're finding that people below the, of course, I don't know what is their this thing of below poverty line, but those who are very weak socio-economically, it seems they have more access to cheap food, which is nothing but processed food. Because processed food is cheaper. Therefore, they're finding that in the Western countries, those who are of very low socio-economic status, they are having accessibility to unhealthy, cheap food and they're putting on weight. Whereas in India, it is not so. It is basically voluntary. Okay, so we are going into that. We are trying to ape, we are trying to follow the Western customs, and we are trying to eat things which are not really safe for us. So what has happened is in India also, we have options of unhealthy, cheap food available, processed snacks foods available. That is one thing. Second one, in India also, limited healthcare facilities. Maybe the rural population has accessibility to Lay's chips or that may be possible, but then healthcare facilities are very limited in the rural areas, especially in India. Because what is happening is here that especially in rural areas, those who are dependent entirely on the government healthcare system, they're not really getting what they need to do, what they need to get, and they're not screened properly. Many of them are not even aware that they're diabetics. And those who are diabetics also, they don't get adequate health facilities and they're not able to go to the urban areas for their treatment. And of course, less exercise and obesity has become now, we cannot now distinguish between urban and rural because it's become a common thing, and that's so both in Western world as well as in India. In India, there is another thing which we have to see. That is, of course, malnourishment is also there, especially during pregnancy. If a mother is malnourished and if the child is a low birth weight child, the chances that later on the child may become a diabetic are very high. So malnourishment is one of the factors. And of course, we already talked about urbanization. and slums, where the environmental factors which contribute to infections and other things, which is very high in these places. Then, of course, we come to the pollution. I think in this urbanization, I would like to, say something also that, there is something called as a population density index. And if you see the world map of population density, which I should have probably told you in the previous slide itself, we have found that India has the highest population density, actually, which is more than 500 per square kilometer. So there are 500 people, more than nearly between now in the latest is 23 or something, 24, which is 492 people per square kilometer. So that's the population density. When you have more population density, it means you have less space, less living space, less space to walk around, less green space, less scope for exercise, okay, more scope of infections. So if you see, there is a map, population density, map, you'll find that India is black. There's no other part of the world which is, it's all in light yellow, orange, red, but India is actually black. The whole of our country is showing high population density, which we are taking as an average. Of course, if you go to a very, remote rural area, there may be hardly 1 to 10 people or something there per square kilometer. But here, on an average, we are finding it's 492, almost 500 people per square kilometer. So just imagine the population density. Then here we find next is the pollution environmental factors. Naturally, industrial waste, rapid industrialization. Earlier, the industries were supposed to be outside the, residential areas. They used to be outside, the town or outside. But now we find that there are industries next to our, absolutely next to our apartments, because the cities have expanded so much that there's no distinction. We find industries right in the middle because we have encroached upon those areas. So the pollution is more, there is rapid increase in pollution because of industrialization. Industrial pollutants, we are hearing of, especially in Bangalore, the lakes foaming, because the industrial pollutants and the chemical waste are, literally pumped into the lakes which are there. We don't have rivers here. So we find that, and that's true, wherever there is any kind of a water body, all the chemical pollutants are into the water. Pesticides, especially nowadays, we find that there's so much of pesticides which are to prevent, we find that it is to prevent any of the, kind of what you call the local, from the vegetables and other things to get, so that they get enough of yield, they're using pesticides to protect the yield. That is what is happening. So industrial exposure, exposure to industrial pollutants, pesticide. And now we are finding that air pollution has become one of the major problems now. There are particulate matters which are less than 2.5 microns, rapidly increasing. And why this size I'm talking about? Because such small particulate matters can get into the lungs of the individuals and cause lung problems and infection. Nitrous oxide, the levels of nitrous oxides have gone up. Then ozone, layers are coming down. Smoking, everywhere smoking is there. Food pollution because of the pesticides, and there's a lot of food pollution. So how do these pollutants really affect, especially in diabetes? It is said that how do they damage? One is what is called as the endothelial damage. What is the meaning of endothelium? Endothelium is the innermost layer of the cells of the arteries and arterioles, the blood vessels in our body. And these particulate matters and these kind of industrial pollutants, pesticides, etc., are supposed to get absorbed in the body through lungs and through our gastrointestinal system and go and accumulate in the endothelium of the blood vessels. And what it does is it causes what is called as an oxidative stress and inflammation. Therefore, today, actually, diabetes is called as an inflammatory disorder, because diabetes is known to cause a large scale inflammation in the body. So it's even called as an inflammatory disorder. So the oxidative stress and inflammation is more, and that inflammation is happening in the cells which are producing insulin. which are causing insulin resistance, which are causing deficiency of insulin. And these things are called as endocrine disrupting chemicals. Most of these pollutants are called as endocrine disrupting chemicals because they disrupt the function of the endocrine tissues. Because we know that for diabetes, for a proper for a proper utilization of the sugars in the blood, for blood sugars, for one to remain a non-diabetic, there should be a proper utilization of the blood glucose that gets absorbed from the gut. And what we need is a proper system where adequate hormone called as insulin produced. At the same time, there is a adequate mechanism of absorption of that glucose into the tissues, into the muscles, fatty tissues, etc. That's not happening. All these pollutants, what they are doing is they are causing these are called as endocrine disrupting chemicals. And this is the reason for various other problems also like heart attacks and all that. The same mechanism holds good there. And because of this pollution, there are frequent infections. When there are more frequent infections, the immunity comes down. The infections affect all the endocrine system also, insulin producing cells also. And at the same time, because of frequent infection, we are frequently exposed to medication. We are taking all kinds of medication to keep us free from infection. And every medication that we take, whether it's an antibiotic or whether it's a steroid or whatever it is only going to cause further disruption in the entire metabolic system. Okay. Then most important is the stress. Nowadays, they say, many of my patients, when they come with uncontrolled blood sugars, they have only one question to ask. Doctor, I've been in stress for a long time. Is this the reason for my blood sugar to go up? Yes, it's a very important factor, no doubt. Stress is an important factor for converting a person from pre-diabetes to diabetes also. For a person of a controlled diabetic to go into an uncontrolled state, stress is also one of the reasons where the medication for diabetes increases. Many people have to go on insulin at that time. Stress can be of various types. It could be an environmental stress. It could be stress because of various other things, emotional stress. It could be stress of the diseases, other diseases, frequent diseases. Stress could be of any type, but we are here talking about the environmental stresses, especially in today's world, the socio-economic pressures, the environmental stress. I talked about that population density already, that we have to live in such closed, and with so many people around us. So population density, I already talked about it. Traffic density. There's so much of traffic stress. Driving is a great stress now. I can tell from my own experience, I'm very stressed when I drive because you don't know. You may be careful, but the other people cause you stress. So traffic density, which increases my traveling time, and I'm exposed more to the pollutants and air pollution outside. And it makes me lazy. It makes me more sedentary. There are people who are traveling for 2 hours at a time, 3 hours at a time, one way to reach their working places. As the traveling time increases, your sedentary time increases, and probably your eating becomes more in the traveling time. Then we have coping mechanisms. The coping mechanisms are failing these days. With the breaking of the family values, with the breaking of so many systems, there is difficult coping mechanisms. And coping mechanisms difficulty will come further. There are a lot of reasons for that. Rapid urbanization, single unit families, single parents, and the current exposure to the, changes that the youngsters, children are exposed. So many things where coping mechanisms of an individual are coming down, causing stress. And then stress-related disorders are more. Hypertension, thyroid issues, heart diseases, stress-related. More important now, in the recent past, with the IT industry booming, long hours of work, 11 hours, 12 hours, night shifts, sleep deprivation. There's a whole that, our bodies are meant to, come down in our work, sort of start settling down by sunset and rest by the time night falls. Get up early in the morning. Our systems are not meant, nobody else other than the human beings in this entire, the living beings, where we are working, sitting up late in the nights, working, disturbance in sleep. causing lot of problems associated with diabetes, increasing the risk of diabetes. Then we have mental and emotional disorders, incidences going up. Because of so many things, loss of jobs, economical crisis situations, family problem situations, emotional disorders are high, mental disorders are high, and many people are on antidepressants. Many people are on antipsychotic agents. And mind you, all these antidepressant, antipsychotics, they can cause obesity, they can cause actually have a direct effect on diabetes also. They can have a direct effect on high blood pressure, kidneys, so many things. And diabetes is not something which is isolated. It is something which involves all the organs of the body. It involves all the organs of the body. So therefore, we find that mental, emotional disorders and the treatment that's causing also a lot of problems in these people. Socio-political conflicts, people are displaced, being displaced, their houses are being lost, so many social political conflicts where there's an unsettling of life. Then we have addictions. Very easy. Addictions are easier now. Nicotine, alcohol, recreational drugs. It's not at all difficult. Last thing in environmental stress is loneliness. Nowadays, the incidence of loneliness has gone up. Though the population has gone up, though the population density is high, but the incidence of loneliness is high because of the breaking down of all our social and cultural values, which have really changed very, very fast. It's not a slow change, it's a very fast change. Continuing the stress, noise pollution. There is so much of noise pollution is also known to worsen all the metabolic disorders, including diabetes, noise pollution. Then long hours of exposure to screen. Of course, we may find out why this particular reason is being given everywhere now. It is true. We are finding that people are becoming diabetics at younger age than would have happened earlier. Again, long hours of exposure to screen. That is because we're all the time sitting, no physical activity, and we don't know what we are eating. As we are watching something, we are eating something. And most of it is packed snacks, most of it is something easily available junk food. Breaking family units, single parents, they can't cope up. So here, coping mechanism, they're all related, they're all interrelated. Senior citizens, neglected senior citizens, because many times there's nobody to take them. There are senior citizens I see, who need medical attention, but there is nobody to bring them, nobody to take them, and they cannot travel by themselves, either because they can't see clearly or they're not, mobile enough. So the neglected senior citizens, very high complication rates of diabetes in senior citizens, especially those who are neglected. Then in younger people, adolescents, we have education stress. Education has become more of a stress now than a happy thing. We were all happy to go to school and college, but today's children, they find it very difficult because educational stress, to be always in the race, to be always first in the race. So that stress is all the time there. Job stress is there, marks stress is there. So naturally, that also gives rise to breaking down of most of the metabolic processes that are likely to happen. Of course, then we have physical health, mental health, chronic medication, metabolic health. Now we are finding that there are lifestyle disorders at a very young age. We are finding very young people like 25, 26-year-old, they are having high cholesterol levels, high triglyceride levels, high blood pressures. I see so many. At least, maybe I can say 1 in 10 patients that I see, they're less than 30 years of age. Lifestyle disorder, wherein all these factors are contributing. Then we have, as already told you, major psychiatric disorders. Though I talked about the mental health and nothing, major psychiatric disorders, very severe depression, bipolar depression. Of course, they may be genetic also, but the environment is playing a great role in major psychiatric disorders. And the treatment given in major psychiatric disorders definitely makes diabetes control very, very difficult. In people who are on antipsychotics, the diabetic medication becomes very, very, difficult to adjust. At the same time, they have side effects like obesity, etc. Long-term medical therapies, multiple medical therapies, like those who are having, asthma and other things, those who are on long-term steroids, those who are on long-term antibiotics, those who are patients of cancer, malignancies, those who are on long-term therapies, arthritis patients, those who are multiple long-term therapies, psychiatric disorders, all are contributing to that. And this is all again because of the environmental factors, most of it. And there's a very important thing now, disturbed gut microbiota. There's a lot of research going on this gut, microbes. Our gut has certain microbes which are a different colony itself. It's a population by itself in our gut. And those gut microbiota, they are necessary to keep the metabolic, scenario of the individual in its normal state. But we now have the disturbed gut microbiota because of all these factors that you have seen, especially chronic medication, stress, that's causing disturbance in gut microbiota, which is also one of the reasons for early diabetes, uncontrolled diabetes, and pre-diabetes going on to diabetes. So many of our seminars right now, medical seminars, are definitely having at least 1 or 2 sessions on gut microbiota and diabetes. That's become, and of course, various other metabolic disorders. But diabetes is not a single disorder. It brings in with it a lot more. It's like noodles. You can't pick up one noodle, with one noodle, so many come. So diabetes is a metabolic disorder. Diabetes cannot be there alone in isolation for a long time. Initially, it may be that a patient comes to me with only diabetes, but it is not in isolation. There's associated hypertriglyceridemia, dyslipidemia, hypertension, cardiac problems, cancers, everything. It's a whole package itself. So it's an associated metabolic disorders. Of course, we already saw this cultural practices, changes in cultural practices, attitudes. So there is more opportunity for socialization now, more opportunities for alcohol, eating, very oily foods and unhealthy foods eating. So more socialization, more eating, excessive availability of food, whatever it is, more exposure, easy availability of nicotine, alcohol, recreational drugs, which are no longer considered to be a taboo, no longer considered because it's so easy level and everybody accepts you. Alcohol is accepted, nicotine is accepted, recreational drugs are accepted in, especially when there is socialization. Therefore, that is one, very, very important change in our cultural practices. Then it's very important because as cultural practices change, our bodies are not used to that kind of a change in this practice. Then, of course, advanced age. Medicine has advanced. What we are doing, we are only increasing the longevity in most of the people. Our longevity has gone. But what is the quality of life? No, it is poor because it is we are somehow preventing people from dying, but we are not able to do anything to improve their quality of life, either because of inertia on the part of the patients themselves or a non-affordability on the part of patients to do something about it, or maybe it is some kind of an apathy from the health system also. So advanced age, as advanced age is happening, social isolation, loneliness, no family support, all children are outside, only 2 old people are in a big house and one of them dies, only one remains. There is absolutely no connection with the children, no connection with the relatives. So everyone is alone. And of course, now the new trend of nuclear families and now micro-nuclear families also. Nuclear families also now coming down to smaller ones. Now healthcare access, very important. Are we really having the access to healthcare as it is necessary? As I told you, a shocking revelation on this year's diabetes, World Diabetes Day 2024. 1 in 3 diabetics receive treatment. Okay, 1 in 10 diabetics get diagnosed. Then, so lack of professional healthcare system in remote areas we saw. Even in the urban areas, people are not willing to, take, the advantage of the presence of doctors and health system. I have patients who don't get their blood sugars, known diabetics, don't get their blood sugars tested for 2 years, 3 years, 5 years. They don't come to a doctor for 3 years, 5 years. Today I saw a patient who's coming to me, who came to me in 2020, and she says, I've been taking the same medicine that you gave in 2020. She has not done a single blood test. She doesn't know what is her diabetes status. And she comes in, I'm taking the same medication, I'm coming to you after 5 years. So an apathy is there on the part of patients, even in the urban areas. We can blame the healthcare system, but where it is available also, people are not really interested. in keeping themselves healthy, taking everything for granted. So there are areas where no screening facilities are not there. Undiagnosed pre-diabetes, we are not diagnosing pre-diabetes. People are falling sick very easily, but we don't think we should investigate them for diabetes. People are coming with 2 or 3 respiratory infections a month, but we don't feel, the doctors don't feel the need to investigate them and find out whether they're pre-diabetics or diabetics already. Why are they falling sick so easily? No, we just give them some medication and send them away. Undiagnosed mental psychological disorders. And one thing is denial and avoidance of screening and treatment. This I'm finding it more and more because of socioeconomic status. Secondly, they are scared that if they are have to take a higher dose of medicines or their lifestyles will be in some way disturbed. So there is a kind of a denial and there is avoidance of screening and treatment. Lastly, quackery. Quackery is one of the very important things where somebody says, some unqualified person says that I will treat your diabetes, I'll cure your diabetes, I will reverse your diabetes. And that's what happens. No proper attention is given. Of course, we said that genetic predisposition, since our topic is more of environmental, yes, genetic predisposition is there, especially in a country like India. Though we may be one country, but genetically we are different people. If you take the genetics of a North Indian and a South Indian and a person from the eastern part, the diverse genetic patterns, we are not one population genetically. We are multiple populations genetically, and our propensity to the diseases is also something which is very different. Therefore, diverse genetic backgrounds, and naturally in India, with a combination of all these environmental factors to which we give least importance, what's happening is more and more people are going into various metabolic disorders, in which diabetes is the most important one. And we talked about type 2 diabetes or adult diabetes so far. And it was earlier thought that diabetes in children or very young children, diabetes starting at 5 years, 7 years, 8 years, what we call as the juvenile diabetics, they were called earlier. We call them now the type 1 diabetics who have a deficiency of insulin. It was thought to be earlier very rare, especially in our country. Even now, type 1 diabetics probably are less than 10%, whereas type 2 are more than 90%. But here we are finding that the type 1 diabetes also in children is increasing. Insulin deficiency diabetes is also increasing, again, because of toxins in the food and water trigger autoimmune system. You know, that's toxins in food and water. Toxins are there because there is no water which is actually potable here. Most of the water is, having something or the other. So because of toxins, climate changes. We're finding frequent climate changes, frequent viral infection. And viral infections is one of the very important causes of destroying the pancreatic cells which produce insulin. And then right from childhood, children are exposed to antibiotics. Gut microbiota of children is very bad now because of junk food, because of frequent illnesses, frequent antibiotics. Vitamin D deficiency, no exposure to sunlight. We are all inside. We are either in the office or we are at home. No exposure to sunlight. So we all have vitamin D deficiency. One of the important causes of childhood diabetes. Then environmental pollution, we saw stress. It's not only the adults who are in stress. A child is probably in greater stress. Then maternal age. Nowadays, we are finding that women giving birth to their first child is over the age of 32, 33. So maternal age has a very, very big effect, especially if there is a family history of diabetic, genetic predisposition of diabetes, and if the maternal age is more, then the chance of the child becoming diabetic earlier is very high. Then, of course, birth weight, low birth weight, we saw malnourished births one known for developing type 1 or childhood diabetes. Of course, unknown and known environmental factors are also there. And this urbanization, we have found that children who are there for say 8 or 9 years or 10 years in rural areas, and they come to the urban areas and they suddenly are exposed to a totally different environment. We're finding that such children are developing insulin deficiency diabetes very soon. So why are we so worried? Last one slide, I think we have. Why are we so much worried about the environmental factors? because environmental factors is something which we can do something about. I have talked about so many environmental factors here. Most of the factors may not be in our control to control, but whatever is possible for me to do, I can do it. Maybe I can, to some extent, take care of my diet. To some extent, I can avoid all these junk food. To some extent, I can see that my exercise is increased. To some extent, I can see that I maintain my gut microbiota healthy. To some extent, I can see that I sleep early, reduce my screen time, and don't go on being a couch potato. Try to use the stairs even if there is a lift, even if it's 2 floors or 3 floors. Where I can walk, let me walk. If it's a short distance, let me not depend on anything. No, I don't do that. Then what has happened? So one thing is reversal, what we are talking about nowadays. Let me tell you, reversal of already established diabetes is not possible. Don't fall for any of these false advertisements on the internet. Reversal of diabetes is what we mean is, if you're a pre-diabetic, we can postpone the appearance of your becoming a frank diabetic. That is all it is. If you are a very, very mild diabetic, it can be reversed back to the pre-diabetic stage. That's all. But a person who is a 5-year diabetic, 10-year diabetic, already on multiple medication, no possibility of reversal and there's such thing. And if we really want to postpone our becoming diabetic, I think we have to be worried about what are the environmental triggers, and whatever is under my control, whether I can do what I can do. So it is to prevent pre-diabetes to diabetes conversion. There, that's the main role actually. Reversal really doesn't see. The main role of environmental factors which we have used to prevent pre-diabetes from going on to diabetes conversion. And if I have a strong family history of diabetes, a strong genetic background of diabetes, is there something I can do to postpone the appearance of diabetes in me by handling the environmental factors which are in my control? And also the environmental factors help me in better management and better quality of life. Simply taking medicines, keeping my diabetes under control is not important. Keeping what is my quality of life, that becomes very, very important to me. Of course, these are the references that I have taken. So I think I know that there's a lot of information, and each of my slides can be taken for one full talk, because how each one, because we have references for everything. We have with percentages, what is this particular, how it is affecting this, how this factor is affecting, how many, what is the percentage. So it's not possible to really have that kind of a detail talk. This is just an eye opener, just an introduction to how environment and a metabolic disease like diabetes are related. It's true for all other metabolic diseases also. I think with this I'll stop, and if there are any questions I can take it. Sonam, if you can coordinate with the questions.
Yes, yes, I'll do that. Thank you so much. Thanks. I think this was such a uh, insightful, a segment that not just talked about the environment. Like towards the end, you did mention that there are some environmental factors that are in your control. You also, kind of pointed out our own laziness, right, in the whole westernized, industrialized context, and to some which are really beyond our control. They need policy, they need advocacy for spreading more awareness, supporting the underprivileged, so that the general overall population also kind of, gets more informed about the perils and the issues with the disorder. So many elephants were kind of addressed, which one does not really think about in the big picture. And I think that kind of gave us a good insight into the aspects that, in the positions that, many of us at IWSA are, and if something can be done, not just limited to our own well-being, but also for the whole society. I think that kind of, brought up a lot of thoughts and ideas for many of us. So hearing the comprehensive approach to diabetes management, it has, I'm sure has sparked a lot of curiosity in the audience. And I'll request you all to please unmute yourself, or, type in your questions into the chat box.
Sonam, I just wanted to make one comment with regard to obesity, which I have not included in the slides. In today's world, today, like in the name of body shaming or not by this thing, it's okay to be fat. It's okay to be fat. And
Hmm.
I become very, very compliant about it. At least earlier, I was worried about what somebody else would say.
Hmm.
Okay, even though I was not bothered about that. Today, in the name of, it's okay to be fat. It's okay to be obese. It's okay to eat out what I want. That's fine. But then, how is it affecting me metabolically? How is it affecting my quality of life?
Correct.
That I'm not seeing.
Hmm.
Yeah.
I think in the process of including everyone and not making anyone feel bad about the realities of life, we kind of have changed the direction of making everyone feel more healthy, as you rightly pointed out.
No, fat is not healthy. Obesity is not healthy at all. No.
Mm.
I think that's
That's
one
what I'm
thing.
meaning. That in the whole context of wanting to include everyone and every directions, the meaning and interpretations of
Yeah.
health
Yes.
have been twisted. So that is a correct case. Can I request everyone to, if all those who are comfortable, to also please switch on your
I think
cameras.
I saw some few questions in the chat. Uh, I think yeah.
I'll take them. I'll take them. I just feel that it's the 60th, and if people are comfortable, then they can switch on their cameras. We'll take a nice group photo, right? And we will for sure move into
I
the.
think there was a question about treatment of type 1 diabetes. It's
Yes.
basically insulin only. Because we have, I think Dr. Maitri asked this question.
Yes, yes.
Type 1 diabetes is because of insulin deficiency. It's not insulin resistance. And here we have to replace the deficient insulin. And therefore, we have to, treatment is only insulin. And even
I,
type 2 diabetics later on become insulin dependent because they also lose the capacity to secrete insulin. So, it becomes, yeah, it's only insulin. It for type 1 and later in type 2.
Thank you, madam.
Somebody has
I'm
asked,
Dr.
what can we
Maitri.
eat for breakfast? And see, what I feel is, whatever we are used to eating right from our childhood, let us eat that. All the modern diets there are so many diets, or eat only this one, this you eat for breakfast. It's not necessary. Whatever we are used to eating from our childhood, let's not change that. Only thing is, let us include more fiber in it. That's all. One doesn't have to change from wheat to millets. It's not necessary. If you can take it, no problem. Nothing wrong. But there are people who are used to a certain kind of a carbohydrate and suddenly change of that carbohydrate at the age of 60 or 70 or something, and you suddenly change over to millets or ragi or something. People can't take it. Their gut microbiota cannot take it. So I tell my patients, you're used to something, take that. But then, eat in this one. For example, Bhagyeshri, I think she asked me this question. For a South Indian, what are we used to eating for breakfast? Idli, good, no problem. Okay, dosa, no problem. But see that you don't put much oil in that. Let there be more, grains included in that dosa. Upma, what is wrong with our South Indian breakfast? Of course, as long as we don't, North India, of course, they eat jalebis and milk. We are not used to that. They are used to that. If I start eating jalebis and milk for breakfast, I'll not be able to handle it. What am I used to eating right from the beginning, from my childhood? According to my social, let us eat that. Let us bring down the quality. Let us increase the, quantity of fiber. Let's walk around. Let us have more exercise. That's enough.
Dr. Sudha,
Yeah.
Malti here.
Yeah.
Remember me?
Yeah.
Lalita's friend Malti. So I was very happy to hear about one thing about the non-reversal of diabetes, and how much we get carried away by all these
Yes.
advertisements and all these gimmicks.
Yeah.
And I always used to think, what is this possible? Because when once it sits on you for years together and you're on medication,
Established diabetes cannot be reversed.
because
It cannot be reversed.
both of us are managing for the past
Yes.
7 years, both
Yeah.
me and my husband.
Yeah.
So, and we are quite comfortable managing it.
Yeah.
And but one good thing we do, as you pointed out, every 3 months or 2 months we get it checked from the laboratory, and at home, almost once in 15 days, 20 days, we check it ourselves. So this awareness has come, but always it used to worry me. Maybe I should take this course on reversal and all that. Then now I feel happy.
See, there is just a change of diet so drastic in that reversal, whatever they do. It's not sustainable, man, doctor. It's not sustainable.
Yeah.
What you're used to, do
That's
that. Don't have any kind of these crash diets, and it's not sustainable. It's not, because for a few months you may feel, that okay, it has come down, but can you maintain that? Can you sustain that? It's like going on all these, there's some institutions where they put you on a fasting diet for 14 days, put you only on liquid diet, and you lose 10 kgs and come back. Your diabetes naturally comes down. Once you come back home, can you sustain that diet? How long will you sustain it?
I know. That's true.
So we have to be more practical, when such things are suggested. And it's only the doctor who has known you, has understood your problem, can guide you and say, look, this is not sustainable for you. You'll not be able to handle this.
That's true. Thank you.
Yeah.
I think an extension to her question would also be like you addressed what we can eat, but when can we eat? Because in today's modern fads of intermittent fasting and increasing the duration of gap between food.
Correct,
So what
Sonam.
side advice?
Correct, Sonam. I'll just intervene on that. This latest fancy diets that are coming, and these young couples are finding it very convenient. That whole day they feel proud that they had the whole day intermittent fasting. But it is not teaching them the habit of controlling the food. That habit or that behavioral lifestyle is not coming there, because after a certain period they are having anything under the sun once the intermittent fasting is over.
Yes.
So that is still not bringing the concept. Till 8:30 I cannot, till 6 p.m. I cannot eat. After 6 p.m. they go for all the endocrine disrupting food.
Yes, and even the advertisements say those 8-hour window you can eat anything you want.
Anything you want, so
Anything
they feel
you
very
want to eat for
happy
8 hours
and
and
they
fast
feel
for 6
proud.
hours. What
And
kind
then
of...
there is a rebound happening in their
Yes.
weight.
Yes.
There is a rebound happening.
Yes.
And the youngsters are still not agreeing to our old way of, applying the diet
I
habit.
have
The
seen that,
concept is, how can you control the quantity? Even a mother who is giving a good food, you said, you stick on to the old habits. But the mother is still overfeeding that child.
Yeah.
Okay, can you have 6-7 chapatis? Can you have 6-7 idlis? That control is not there in today's mother. My son is studying so much, so he should be overfed.
Yes, that is there. That is a cultural change again. And secondly, one more thing I'll tell you, we are always in a satiety state. We don't know what is hunger. You ask a child today, do you know what
Even
it
for
means to
5
be?
minutes, our gut is not getting any rest.
No, there is no question of, there is no, if you
Late
ask...
night, 3 o'clock, you
Correct.
can click a button and you get your food.
Yes, and what does it feel to be hungry? Nobody knows. That's why we say in diabetes, we are in a constant satiety state. All the time we are in a fed state. So that's what is happening. And intermittent fasting, it works for some people, but I have seen that in many of my patients, it doesn't work. It
That
just doesn't work.
concept, if that particular client or somebody has followed, what is the science behind it, then she will know.
Yes.
Okay,
Yes.
first I'm reducing the weight, but let me know what is it actually about, why I'm doing it. Thank you
Surekha
so
ma'am, you
much,
had a
ma'am.
question? Thank you. Thanks, Priya. Surekha ma'am, you unmuted yourself. Do you have a question? Okay, so in continuation of the same...
Ma'am, I have one question. Can I put my question?
Yeah, sure.
Okay. Doctor, it was really nice listening to your detailed presentation, and I have maybe 1 or 2 questions.
Yeah.
So I also have been diabetic for the last, say, 10 years or so. And in the process, what I have gone through is that I have drastic weight loss. I have lost my weight drastically. So can you please suggest me as to how to put on my weight?
See, we have to rule out, there are a lot of things. See, this is a what you call an individual patient question, I would say. And many times diabetics lose weight because of various other reasons, other endocrine disorders, other metabolic disorders, thyroid disorders, or after a certain age, we have to rule out malignancies. So you have to work up the case to see why one is losing weight. Most important, after a certain age, there is something called as a sarcopenia. Sarcopenia means the wasting of the muscles, skeletal muscles. If you are not having enough exercise, just diet alone is not good. Some amount of the muscle training and some amount of keeping the muscles in there, that's very important. And it is a natural process after the age of 65 to lose muscle mass. So most of us find that our arms and thighs, they're becoming thinner. It's not because we are losing weight or fat, it's because we are losing muscle. So that's also something which we have to see, whether we are losing muscle or whether we are losing fat. But this is something where the individual, we have to work up the case individually and see whether it's a muscle mass loss or a fat loss. And if there is a weight loss, is it due to the gut microbiota? Is it due to any other associated metabolic disorder? Or is it purely due to uncontrolled diabetes? Or is it purely because of some kind of a dietary, like for example, some kind of a fasting? Many people have that nowadays, going too much, for this fasting states, and even that is overdoing this, what you call fasting, just to lose weight. That's also, something which is the extreme. So we find various reasons for it. And offhand, it is difficult for me to say, in your case, what is the reason why you are losing weight? You have to see your regular diabetologist, and this is some of a concern which has to be worked up in an individual case.
Thank you, doctor. Let me tell you that I am now 50 plus, and my diabetes has always been controlled through my walk and jog. So every day I walk for say 5 to 6 kilometers, and then I also jog for say minimum of 20 to 30 minutes a day. And I'm very particular about my diet, and still I'm like I have lost my weight very drastically.
You
So
have
it
to
is a
see whether
matter of
your
concern
diabetes
for
is
me.
controlled. You may be needing insulin. That is possible. Many people, diabetics, after a certain time, they start needing insulin. And if your sugars are not very well controlled, you need to take insulin. So temporarily, you may have to go on that continuous glucose monitoring and see what are the variations in your glucose, whether you require insulin, whether you require something else, or sometimes the diabetic drugs themselves. Some drugs in diabetes can cause weight loss. Long-term use of certain drugs can cause weight loss. So whether such drugs where you are taking which are causing. See, this is something I think, Pushpa, it's something which has to be dealt at a very individual level. I don't think we can take up this at a common platform, because it's very difficult offhand for me to answer this question.
Thank you, doctor. Thank you, doctor. I have been taking some Ayurvedic medicines like Diabicon DS, and through that, I have been controlling my sugar level, and it has never
Hello?
been too high. Like just maybe a week back, I got my sugar level tested, and HbA1c is just 5.7 this
Then you
time,
need to
and
rule
it
out
has not
other
been in a.
problems, because see, I have nothing against Ayurveda. It's a system of medicine, but any Ayurvedic medicine taken for a long time can cause liver disorders, kidney disorders. I don't know whether you have been investigated for any kind of especially what we call as metabolic disease associated fatty liver, which is another important cause of weight loss. So as I told you, Pushpa, I think this is a very, very personal question which cannot be discussed on a public platform. It is something which you have to discuss, or you have to take the help of your individual doctor, and it has to be worked out.
Thank you so much, doctor. Thank you so much.
Ma'am, is urinary incontinence a common side effect that is seen when the sugar is at its peak level, or
Yeah.
passing urine difficulty?
Yeah.
Is that seen in patients?
Yeah, it is possible, because one thing is urinary incontinence can happen as one ages. Secondly, in diabetes, there can be, some problem with the periurethral and perivaginal tissues where there is a possibility of certain fungal infections happening. And at the same time, a diabetic, especially in a female or in a male prostate associated problems with diabetes are very common. In a female, urethritis and what is called as asymptomatic bacteriuria, asymptomatic urinary infections, they are very common. So that is something, and incontinence also has to be worked up. We have to, we have to find out why there is an incontinence, whether it's stress incontinence, whether it's urgency incontinence, whether it is, incontinence all the time, or what kind of an incontinence is it. And that has to be, we have to make out. Diabetes alone may not be the reason for, incontinence. There are other associated things also.
Okay, ma'am. Thank you so much.
Well, I think if no more questions, we can.
There is one more from my end.
Oh,
So, a few days before, when we were watching the latest episode of Shark Tank, one of the patrons, she actually said that, there are these weight loss pills which are given away in kitty parties. And these weight loss pills are actually Ribelsis, which is a diabetic reduction wala medicine. And it leads to weight loss because of the way in which it functions. Now, what happens to a body where, it's a non-prescribed, aise hi sabko mil jata hai, and you're consuming it, you don't know whether it is, what are the limitations of the medicine, how long you can take, because they're taking it for 6 months, 7 months, and then after that, what happens? Yeah.
It's not at all correct, because in the West, Ribelsis or Olympus is used as an anti-obesity drug. But in India, it is not yet allowed for anti-obesity. It is used for diabetes with obesity. And then there are ways of taking it. There is a dosage which has to be gradually increased, starting from 1 milligram, 3 milligram, 7 milligram, 14 milligram. It's a doctor who can adjust that. We can't simply distribute it like a packet of chips, and it's a very wrong thing that's happening. But I don't know how they get these medicines without prescription to distribute in kitty parties. It's something I can't believe. I'm hearing it for the first time.
No, because when it came up on the Shark Tank, I was like, "Ye sawal, we should ask our expert," because
it's not correct at all. It's not at all correct. It's not at all correct. And then many people, even with Ribelsis, if their lifestyle is not good enough, Ribelsis doesn't do anything. Let me tell you, no diabetes drug can work alone in isolation without lifestyle management. It's not possible. No amount of, even insulin will not do its work if you are not capable of, just because I'm on treatment, I can eat anything, do anything, that won't work.
Thank you, Sudha.
Welcome.
Thank you. Thanks a lot.
Thank you so much. It was very informative.
Thank you so much.
Thank you.
Thank you.
And you really made our 60th edition special.
Yeah, thanks.
One.
Thank you, Sudha.
Thank you so much. Thank you so much, Lalita.
Yeah,
Thank you, Lalita. Nice seeing you.
Beautiful talk. Yeah.
Fine
Nice
then.
seeing you, Malti.
Okay. Bye then. Bye to all of you.
Bye.
Okay.
Thank you, doctor. Thank you.
Thank you. Bye.
Yeah.
Bye.
Okay, bye.